I have the honor and privilege of handing over to the Deputy Minister who is going to provide us with concluding comments and remarks. Honorable Minister, I call upon you.
Yeah, there was a bit of a glitch there, but thank you very much, facilitator of this session. Let me firstly start by thanking the presenters who presented here today and for their incisive inputs on this very important discussion. And I think the overall, let me start by just making overall reflections on what I think we, have learned and gone through today. And I think most importantly, what we gathered from most of the panelists is that the socioeconomic implications of COVID-19 and the fact that it has extremely widened inequality and other forms of social exclusion. And I think that point came out quite strongly from the different, particularly in the second panel. And secondly, that we have to make sure that vaccination and other forms of interventions do reach the most vulnerable people in society. We've had how many have argued in our country that we need to open up in terms of the procurement of vaccines. We need to allow the private sector to play a role and all of that. But I think that our preoccupation as government should obviously be to ensure that there is universal access ultimately to vaccination. And thirdly, that there's also a need to ensure that our response to COVID-19 is not reduced to a monologue between scientists speaking amongst themselves, and that it is important that scientific data and interventions are communicated in a manner that is understandable by people of all social groups and in all languages, so that we make the science accessible, so that people are not vulnerable to disinformation. And also that we have to emphasize, and I think the point came quite succinctly, I missed bits and bits of the last session on indigenous knowledge system, but I think, because I was trying to monitor the budget by the Minister of Finance also at the same time. But the question of indigenous knowledge system and also, the question of indigenous healing practitioners is going to be very, very crucial, because whether we like it or not, people, when they are in distress, not only are they vulnerable to, disinformation, but also that they want to use what works, exchange within communities, the value of information that they get from their neighbors and all of that, is one of the things that and in most instances, the role of indigenous healers and practitioners, is quite crucial. And we've seen how, the information or disinformation on what people need to do if they have COVID-19 or to prevent it has basically pushed people into doing certain things. For instance, steaming, and all of that. So the question of, and all of this were regarded as part of, traditional forms of interventions in dealing with COVID-19. Yes, we need to be effectively dispelling the myth of disinformation in society if our engagement with the public, is disregarded, and we need to de-elitize our public engagement. And I think that's crucial. The role of vaccine in disease prevention and our contribution as a country, to historical knowledge on vaccines, I think that point came out quite strongly, and that this is not the first time that we are vaccinating, but I think that, this information is much more crucial if it's sent out into the public, because our perception of vaccination on COVID-19 seemed as though this is the first time that we're going to be doing this. And it relates to how we deal with science and make science accessible to the majority of people in our country. And then the information also around the various vaccine research and programs that are currently running, the mandate that the president has given us, and I think the points that the minister has made and some of the panelists have made around the work that we're doing and how important, that information is accessible, but also is provided in a responsible fashion, because it can, as we've seen, trigger hysteria. It can trigger people to resort to various forms of prevention, and because they are extremely vulnerable. And then the discussion around the development of local vaccine, I think that's one of the discussions we probably need to zoom in. That's the point when I was engaging with the colleagues in the department, as to, when are we having this kind of a discussion? And I think part of what we had today was throwing light into what we are doing as it relates to that. So those are some of the broad issues that I think came out, from this. But just briefly, in consideration of time, I think we need to acknowledge that the advent of COVID-19 has brought with it, obviously, a number of complex problems and social challenges. And one of those is disinformation, and that this problem has become so serious that it is now also referred to as the infodemic. The increase of disinformation on the coronavirus has created a number of problems for governments, including undermining the policy responses and entrenching the level of distrust among the citizenry that existed prior to the emergence of COVID-19. And governments across the world find themselves up against influential groups that are able to package their disinformation expertly and make it accessible to members of the public much quicker than governments are able to. And I think Professor Marwala made the point that not only is the public vulnerable, but even scientists sometimes were duped by academic journals which purported to be legitimate when they are found to have been part of the disinformation agenda. And as a consequence, their engagement with the public, governments have found themselves more on the defense and communicating reactively rather than proactively. And all of this and the lack of coordinated and fact-driven communication has put us, particularly as government, in a very, very difficult situation. And these challenges were particularly pronounced on the African continent. And if one looks at the initial responses of such countries as Tanzania and Madagascar, and from all this, we all can appreciate the profoundly complex nature of the challenges that the coronavirus presents with us as humanity. Now, it is out of this realization that the 2020-2021 COVID-19 Global Risk Communication and Community Engagement Strategy of the World Health Organization observed that, and I quote, "COVID-19 is more than a health crisis. It is also an information and socioeconomic crisis." And I think these themes, cut across the various panels that we've had. The pandemic and the associated response are prompting the deepest global repression in nearly a century and pushing an estimated 70 to 100 million people into extreme poverty. The document goes on to say that until biomedical tools such as vaccines or treatments are developed and widely available, people's behavior and their willingness to follow public health and social measures remain the most powerful weapons to stop the spread of COVID-19. And consequently, there's an unprecedented need to elevate the role risk communication and community engagement plays in breaking the chains of transmission and mitigating the impact of the pandemic, close quote. And I think they're making an important point, which is that while technological solutions are crucial for the fight against the coronavirus, human behavior remains the most important variable in the overall, in the overall effectiveness of our response to the pandemic, and to help us understand the behavioral aspects, and in particular the social attitudes towards vaccination. UJ and HSRC conducted a survey that sought to assess people's willingness to take a COVID-19 vaccine. And I think the CEO of the National Institute of Social Sciences and Humanities made the point quite succinctly that we need to see communities as crucial platforms in order for us to understand what their responses are and therefore develop a strategy in order to deal with those kind of responses, because human behavior will also be crucial. And this survey makes some insightful findings, and it was conducted between December 2020 and 6 January 2021, and it used social media adverts to direct potential participants to the survey, and data free through ByNews Moya Messenger app. It was completed by 10,618 participants, and its findings were weighted by race, education, age, and are broadly representatives of the population at large. And it found that 67% of people surveyed said they would definitely or probably take a vaccine, and 18% said they would definitely or not probably take the vaccine, and 15% were unsure. It also showed that race, education, and age are key factors in shaping people's attitude towards vaccine acceptance, and revealed that white adults tend to be least accepting of a COVID-19 vaccine, whereas 55% of them say they would take the vaccine compared to 69% of Black African adults. Those with less than matric level education were generally more open to receiving a vaccine at 72% than those who have completed matric at 62%. And the survey also revealed that support for vaccination increases with age. Political discontent is also a major factor because, for instance, people who think the president is doing a bad job are much likely to want vaccination, and only 36% compared to 73% of those stating that he was doing a good job. So therefore, the most common explanation that people gave for wanting to vaccinate were to protect oneself, which was 29% of the participants, and closely followed by the desire to protect others, which was 25%. And for those who were either unsure or against taking the vaccine, the most common explanation related to concerns about side effects and concerns about the overall effectiveness of the vaccine. And I think these are some of the things that we'll have to zoom in if we are to, if we are to combat the whole issue around communication and disinformation and what we put on the laps of people in terms of information consumption. An explanation related to conspiracy theories or the occult did not appear frequently, 7% and 4% respectively. And these are other credible scientific studies. There are other credible scientific studies are very important for the purpose of enhancing our country's response to the coronavirus pandemic. And to be effective, we must learn from some of the mistakes we have made initially with our initial response. We must ensure that our response is nationally coordinated, community-centered, participatory, nurturing trust, open and transparent, integrated, inclusive, but also more importantly, evidence-driven. And more practically, this means acknowledging the questions and concerns of individuals and communities and providing answers and creating opportunity for meaningful dialogue. We have to assess behavioral and social drivers and adapt our approaches to enable and encourage behavioral change accordingly. Because scientific knowledge is central to our interventions, it is important that we translate science data and evidence-based information into audience-tailored, timely, relevant, and actionable life-saving messages. And related to this, we should increase the opportunities for communities to participate in the design of public health measures and other response interventions, ensuring they meet communities' need. Equally important is the need for enhancing our risk assessments and improving decision-making by providing evidence from social listening, perception studies, social science research, and dialogue with communities. And all of this will go a long way in strengthening the trust between communities and state institutions, but importantly, enhance accountability in the implementation of our response. If we're to succeed in dispelling myths about vaccines and the science of the variant of COVID-19 and consequences on society, we will have to radically rethink the way we engage with citizens of our country. We'll have to be more proactive rather than reactive, and it means where possible, we must seek partnerships with credible community-based organizations. And those of us in the scientific community will have to make an extraordinary effort to ensure that our messages are as simple as possible and that they can be understood by people across the various social and language groups of our society. We can't refer to the information at our disposal as life-saving, and yet we want to continue communicating in a manner that accommodates people in the scientific community. For our response to the coronavirus to be effective, this manner of engaging with our communities has got to change. And therefore, with those words, I'd really like to thank all of those who participated in this webinar, and also those who contributed in organizing it and its success. And I'm certain, as the Minister said in his opening, this will go a long way in helping us to make an impact in how our communities understands that and make a distinction between what is fact and what is myth, between, as it relates to coronavirus and the various variants that would be, that have come up and that would be coming up. So thank you very much, and thank you for listening.